So the burning question for young global health scholars is, what do we want to specialize in? What kind of global health issue am I passionate about? And how do we make this world a better place? So now we're joined by Nadhir to learn more about how his work on hepatitis C in Malaysia can actually make an impact globally, and how it can inspire us global health researchers to enter a field and make an impact and a career out of that field. So, Nadir, why don't you introduce yourself to our guests?
Right. So, hello everyone. So, my name is Dr. Nadhir Adi Azahar. You can just call me Nadir. And I am currently a Doctor of Public Health student in the University of Malaya in Kuala Lumpur. So, I have worked as a medical doctor for the past 10 years, and I've recently decided to pursue my postgraduate studies in public health. And this is where in University of Malaya that I stumbled upon this implementation science or research, which I think, to be honest, I've not heard of it when I was working previously under the Ministry of Health. And that is why I think it's important for us to actually spread all this awareness on implementation science. And with what I'm doing, my background in communicable diseases, throughout my working experience, I've worked in tuberculosis control programs, in hepatitis control programs, even in HIV and also malaria. I do find that having the principles of IR, implementation research, being integrated into our program would definitely help in achieving our goals towards the elimination of these diseases, right?
Yeah, and it's interesting. These infectious diseases exist in our planet. And, sometimes in tropical countries like ours, they're more prevalent than other countries. So, an interesting burning question on my mind right now is, from a medical doctor into a public health program, what made you want to enter into public health in the first place?
So the thing about public health is that when I was practicing, I am still practicing as a medical doctor, but as I've seen a lot of patients that come towards me, be it them having dengue or being them having hepatitis, there's always all these other layers behind them that actually causes them to sort of like acquire that infection. So it's not wholly per se the environmental factor, but there's always all this, as we call it, the social determinants of health that affects the health status, in which eventually makes them sort of at a higher risk to get all these diseases, which, like you said, of course, it's somehow a lot more prevalent in our region. And that is possibly because, again, our environment, if we're talking about vector-borne diseases, but also because of our economic status, our education level when we're talking about other diseases such as maybe hepatitis and also HIV.
Yeah. So we talked about the social determinants of health. That's one of my favorite subjects in global health. I'm really happy you talked about that because, I can see it, like, if based on our living conditions, I don't think it gives us the right opportunity to live, to work, and to play. And I think the ultimate goal of public health is to help us safeguard that future of where people can live, work, and play. And I'm happy that we've invited an expert like you, so we can see how can we do that in our region of Southeast Asia.
Right.
And, one of our agendas in the Global Goals for Sustainable Development is to achieve health equity by year 2030. But we know, because of the social determinants of health and the other instances of how the economy affects health or how education affects health, which of the SDGs resonate with you and why?
Right. So this is where the SDG actually plays a very important role in global health, I believe. The best, I wouldn't say the best, but the most, the SDG that resonates the best with me would be, I think, SDG 1, which is no poverty. Right. So having worked with, in the background of communicable diseases, we know that people living in impoverished areas or people living in poverty, they have poor access to healthcare services. They have possibly poor sanitation or hygiene, that it all will cumulatively affects into them getting such communicable disease. So I feel that by addressing SDG 1, which is poverty, it may also help us in achieving our health goals in SDG 3 and also other communicable diseases goals that the World Health Organization has set. So all in all, we plan to achieve elimination of, say, maybe hepatitis by 2030, of HIV and AIDS by 2030. So we have to acknowledge that there are some population that are impoverished, and some of this population, they are also part of the key populations that are more at a higher risk of getting these diseases. So yeah, I think SDG 1, no poverty, would resonate the best with me, coming from a communicable disease background.
Wow, that's interesting. Because usually health experts like us would say SDG 3 right away. But we looked at it as SDG 1, realizing that if we solve poverty, we actually solve diseases. We solve educational problems. We solve all of these underlying issues that is rooted in poverty. And it's interesting. So you're an expert on hepatitis C. And out of many fields out there, why did you decide to enter into hepatitis C research?
So hepatitis C is sort of becoming a forgotten disease, I would say. It doesn't have quite the awareness or the promotion as other diseases such as tuberculosis or even HIV. But we also need to acknowledge that the burden of hepatitis C, not just in Malaysia but also globally, it's estimated that around 70 million people are affected by hepatitis C, and the morbidity and the mortality of hepatitis C is actually really high. It will lead to liver cancer, liver cirrhosis, which will all lead to mortality for people suffering or experiencing hepatitis C. So that is why I feel like in championing for a disease that is not maybe well promoted, or people are not very much aware of in Malaysia, I had to choose this because I feel like one thing is that it also affects the other marginalized population, which requires a lot more champions in Malaysia. So not saying that we don't have a lot of champions yet in Malaysia, but I do feel that a collaborative approach with everyone would definitely help in us eliminating hepatitis C in Malaysia. I think one more thing that I want to add is, of course, before this, hepatitis C control was possibly deemed a bit difficult because of the access to medicines that were not available to a lot of people back then. But now we have, with the advent of new drugs such as the direct-acting antivirals, it is really accessible, it's safe, you can be treated within just 12 weeks, and you can achieve a cure status just after 12 weeks. And compared to the previous regime, it was at least I think 6 months to 12 months. And with that innovation, that new technology of this new medicine definitely has sort of like pushed us forward into the control of hepatitis C currently.
Oh, so championing hepatitis C for you is more of like a calling. Yeah, because like while there are a lot of people who are aware of hepatitis C, who are working on it, but we need more people on the ground like you, who are looking at it as for people, especially in marginalized communities, who actually need the help, can actually receive that faster and more
Right.
efficiently through evidence-based research. So how do you think does implementation research accelerate this movement of treatment for hepatitis C?
This is where it becomes interesting actually. When I first started, I mean, as a student of Doctor of Public Health, I only had like a gist of what implementation science or research is. And when I've actually studied it, done my literature review, I can see that it will definitely help us make a sustainable impact into our hepatitis C program. So firstly, what we have tried to implement through our IR principles is that we have learned the evidence from other countries, from other models, other models of care from other countries, and even learning from the HIV model of care. So what we are trying to do right now for our hepatitis C treatment is that we are trying to make it a rapid initiation. So we are trying to eliminate all the barriers that marginalized community face in getting screened, tested, diagnosed, and even being treated for the hepatitis C, and we are trying to reduce all that barriers, make it simple through implementation science by learning from other countries and trying to adapt it to our local setting. So even if it's been proven effective in other countries, the interesting part about implementation science is that we need to try to fine tune it or tweak it to our local setting and make sure that it's adaptable to our real world scenario.
Yeah, because like the context in each country is different, right? It's not the same, even though some people think it's regional, like Southeast Asia, we have to implement it in Southeast Asia, but like the context of Malaysia is different from the Philippines, or it's different from Cambodia or from Thailand, or even in Singapore. So it's interesting that you're adding this layer of like how we're actually advancing global health by looking at best examples from abroad, tweaking them a bit, and applying them here in Malaysia.
Right.
And yeah, that's such an amazing work that you do. And
Yeah.
we commend it, we celebrate it, and hopefully more people get into this field of research, especially like what you said, hepatitis C is like almost a forgotten disease that we should be worried about. So, what are some initiatives in Malaysia that could actually be success stories of treating hepatitis C?
Right. So in Malaysia, thankfully, the current Director General of Health under the Ministry of Health in Malaysia is a huge champion of hepatitis C. He himself is a gastroenterologist who handles these patients on a one-on-one basis in a clinical setting. But he has been advocating a lot of public health messages, campaigns, and there have been a lot of new innovative models that Malaysia has been trying out. So, for example, there's the hepatitis C self-testing, which we are learning from the HIV self-testing as well, where we are trying to spread it to the community, because one thing is that hepatitis C is a blood-borne virus, which I think predominantly is more prevalent in people who use drugs. But there has been increasing trend of them we have seen them on the rise among the men who have sex with men, or the MSM population. And we know that this population, they might not like to come forward to our healthcare clinics due to their status. It's still an issue here, even in Malaysia, but we are working on it. But because of that, we are trying to innovate new models, for example, self-testing. So we can see that some of the trials that they've conducted, it's been well accepted by this population, and it's one of the way that we can move forward with hepatitis C testing. And there's also an innovation where we are doing a point of care testing or diagnostic, so that they can find out about their results immediately. We do not delay their diagnostic screening test, and we can immediately provide the treatment to them on the spot. So that is one of those innovative healthcare delivery models that we are trying to implement in Malaysia by learning from other countries as well.
And it's interesting that lifelong learning continues, right? So that we can apply the best practices in Malaysia, for example. It's interesting how these self-testing kits or like these procedures can make it easier and more accessible for people and make treatment faster. But you also touch based on some stigmas around hepatitis. And I know that hepatitis C, since it's a debilitating disease, some people have HIV while they have hepatitis C or other diseases. Do you think that the stigmas around hepatitis C are different from these other diseases, and do they affect each other in a way?
I do feel like the stigma behind hepatitis C is more, I think, in Malaysia, more related to the fact that most of them are actually people who use drugs. So they are coming from that population, and therefore it comes also from that stigma of drug users that we've been sort of like brainwashed since we were kids in Malaysia. And that is one of the things that is quite difficult to combat, because it's been there for a while, it's been decades, and we are trying our best to actually eliminate all this discrimination and stigma by telling people that drug dependence is a spectrum. It doesn't mean that people who use drugs are bad. They have their own reasons in using drugs, and we as people from public health or even medical background, we're responsible to actually help them, to bring them for treatment. And I think, again, as hepatitis C is a bloodborne virus, it's mostly related to people who inject drugs. That is where the stigma comes from. So in promoting awareness on hepatitis C, I think we also need to tackle that part on stigma relating to people who use drugs.
Oh, okay. So these stigma, it's rooted in people who use drugs. So we talked about that with Ika just a while ago. And it's interesting that, all of these are interrelated. These global health issues, they complement, well, not complement rather, like more on, they affect each other. But at the same time, the solutions can actually complement each other. That's what I mean.
Yeah.
It's interesting.
It comes back to that SDG 1, no poverty.
Yeah.
You're able to solve that, hopefully you'll be able to solve a lot of things.
Yeah. Solve one issue, we solve them all.
Yeah.
Okay, that's amazing. And for young people like me, well, you're also quite young. A lot of
I
our
look young.
I look young. You're very humble. We're looking at ways on how to enter into a career in global health, especially you're just undergraduate students. How can we choose a field? What's your advice to young people like us? And what do you think is that time when we say, you know what, this is our calling in global health? For you, it was hepatitis C, but what about other early career researchers out there?
I do feel it comes back to how you approach that issue. It's like we don't view certain diseases or infection as an infections per se, but it's actually a very, how do I say it, a very comprehensive public health challenge that we need to really see the angle from a lot of see from a lot of angles. So for example, I think young scholars now these days, they are more adventurous, they probably more daring or risk taking. So I think maybe community work, right, would appeal to them. So by getting involved in a lot of community work, outreach work, for example, you can actually see what is happening on the ground. And when you see what is happening on the ground, you will actually realize what is it that you want to do, right? When you actually go on the ground, you go for screening with the community outreach workers, for example, then you'll be able to see what actually is the problem that these people are experiencing. And therefore, from there, I think you'll be able to pick or choose what kind of specialty is best for you. It is very important for you to actually see and actually do it, and maybe listen or hear stories from people with lived experiences, right? So that's my advice to young scholars.
I was just about to say lived experiences, and then you completed our interview with the term lived experiences. How amazing is that? So I think these lived experiences bring a field of global health that adds a layer of personal touch, right? We bring these stories from the ground up to the policymakers, up to the universities, and most importantly, up to the impact we want to make. Because a lot of these problems, it has to come from the community, the solutions. We can give them all the advice. Maybe this is your experience as a doctor. We can offer advice. We can offer solutions. But if the patient does not want treatment, then it's over, because the patient is the alpha and the omega, right? And we respect that right. We respect those human rights that these patients have to choose on what kind of treatment they have. But if we put ourselves on the shoes of these communities, then we actually make a career, not just using the community, but becoming part of that, becoming part of their struggle, and eventually solving that struggle together with them.
Right.
And I think that's the highlight of your career so far. You're doing a PhD right now. It's so very noble. Some people stop at MD, but you chose to push even further, and we commend you for that. Thank you so much to our viewers. And I hope you continue to celebrate how implementation research is impacting, infectious diseases like hepatitis C.